PKD or polycystic kidney disease is a genetic condition where the kidneys are filled with fluid-filled sacs called cysts. This is how the kidney would look on the inside, where you see these fluid-filled sacs. On the outside, the kidneys get completely replaced and are enlarged. PKD or polycystic kidney disease is most commonly classified as two kinds: autosomal dominant or ADPKD and autosomal recessive or ARPKD. ARPKD typically affects children. ADPKD is the most common form of cystic kidney disease. It is the most common inherited kidney disorder and the fourth leading cause of kidney failure. In fact, it is thought that ADPKD may affect as many as 12 million people worldwide. Because it is an inherited kidney disorder, people with ADPKD have a 50% chance of transmitting it to their children. Imaging in ADPKD is important because it provides information to your nephrologists to help manage polycystic kidney disease. The size and the number of cysts can determine prognosis and help inform whether you may be a candidate for disease-modifying therapy, clinical trials, or may need interventional procedures to manage your symptoms. Imaging the kidneys can be done either with an ultrasound, with CT scans, or MRIs. All of them allow us to visualize the kidneys, their size, structure, and provide information about future risk of kidney disease. Ultrasound is often the first test used to diagnose polycystic kidney disease and provide an estimate of their kidney size. It is easy to do, quick, inexpensive, and readily available. CTs provide more information than an ultrasound does, but have the downside of being associated with radiation. Magnetic resonance imaging or MRIs have become especially important and the gold standard for kidney disease prognostication in ADPKD. We can not only tell the size of the kidney, but also the volume of the kidney, which we know is incredibly important in understanding which patients are likely to develop kidney disease in the future. In addition, the MRI can also look at patients' liver, pancreas, which are organs where cysts can develop in people with PKD. Deciding which imaging test is appropriate depends on whether the patient already has a diagnosis of kidney disease, is already undergoing treatment, or needs urgent imaging for new symptoms. For the initial diagnosis of ADPKD, an ultrasound is often sufficient, but it needs to be evaluated in keeping in perspective the age of the patient, because the ultrasound may not identify patients with PKD under the age of 30. If we are identifying patients for treatment with disease-modifying therapies, then an MRI may be the best test as it provides accurate total kidney volumes. For patients presenting with acute symptoms such as pain or blood in the urine, a CT scan is often the most rapid test that can be done in an emergency room, providing important information about their kidney function and structure. ADPKD is a chronic condition. It's not a one-time diagnosis and not a one-time conversation. Regular communication with your clinical team is essential. Because disease progression can vary significantly, it's important to understand what your imaging shows, whether you need repeat imaging, and how this imaging is helping manage your care that is personalized. If you or a family member has ADPKD, it's important to understand what the imaging tells you about prognosis and how your doctor can help utilize those imaging results to manage your condition better. Talk to your doctor about the need for imaging in ADPKD.